So okay, everybody got the three measurements. Now what do we do with these three measurements? We just need to send this slide to the technician. He will get his model, he will get his caliper, and he will calibrate the caliper 1.5, and he will make a mark on the left cuspid, pencil. Then on the right central, calibrate 3 millimeters, mark on the model 3 millimeters, make a mark. Calibrate 3.5, go to the right cuspid, mark. So you have 3 marks, and then he will just connect these dots. And then on this case, the midline is matching, so he will draw the midline, and he has the cross on the model to do the wax up. Okay, that's it. That's the basic information. So the sequence that I usually do, I will mount, if the dentist is sending me a face bow, I will mount the upper model with the face bow, then mount the lower against the upper, then I will remove the upper model of the articulator, I will transfer these three measurements, I will mark the line, I will draw the cross, and I will wax up the buccal of the 6 anteriors, only guided by the photos, the video, and the cross. And then I will go back, place it on the articulator, and continue my functional wax up by waxing the lowers if needed, the posteriors if needed. Okay. So the buccal of the 6 anteriors, I will only be guided by these lines, so it doesn't matter if the face bow is off or not. I will make sure that the lines are guiding me. If I'm not using face bow, I will use the mounting plate. Then I think it's better, because I will get the upper model, before mounting, I will make the marks, I will draw the cross, I will wax up the buccal of the 6 anteriors, making sure the incisal edge is leveled with the cross, and then I will place it on top of the mounting plate, so I have the 6 anteriors to guide me on this mounting, so I can position exactly the way it's right, and then I will mount the upper model against the mounting plate. So the mounting plate, the wax up is working as a wax rim if we were doing a denture. So if you're doing a denture, you need to fit the wax rim on the upper model, and then you mount on top of the mounting plate. Here we are doing the same. We level the occlusal plane with the buccal of the anteriors with the wax up, and then you position on top of the mounting plate, mount this model against the upper arm of the articulator, and then remove the mounting plate and mount the lower model against it. Okay? So then when I have upper and lower mounted, the wax up of the upper anterior are made, the next step is that I will slightly open the articulator to look at the incisal edge of the uppers against the incisal edge of the lowers. So the second step of my wax up is to wax the buccal of the lowers. Then I will look at the pictures to see the exposure of the lowers when smiling, to make the decision if I need to level the lowers by increasing the short ones or shortening the high one, the longer ones. For example, usually aesthetically we want to show less lowers and more uppers. So depending on the pictures and on the video is very nice, because when the patient is talking and smiling, you can see usually older patients are showing a lot of the lowers. So then we can reshape the long ones and bring them down instead of raising the lower ones. But this decision can be made. But then we will just level that incisal edge of the lowers with the incisal edge of the uppers. So now we have buccal of the uppers, buccal of the lowers, and everything is aligned with the face. Then the third step is the lingual of the uppers. And when I do the lingual of the uppers, since I have the buccal of the lowers, I'm determining the VDO, the vertical dimension of occlusion. Okay, so that's the third step. So to do that, to make this decision on the wax up, I have to then play with the incisal pin and I will look at how much length I'm adding on the uppers to see what I need to do with the vertical to keep a nice path of protrusion. And of course this decision will incorporate also if what I'm doing with the posteriors. But anyway, I will make the first test on the incisal pin, and I will raise if necessary to allow me to wax up the lingual of the uppers to touch the buccal of the lowers in a nice way. So that's the third step. Then the fourth step is the lingual of the lowers. And the lingual of the lowers, now that I have the position of the buccal and incisal edge in the curve, I can see how thick they are, and I can plan if I have to prep the incisal edge or not to make them more delicate. So the wax up moves and starts guiding us on that. So then I finish the lingual of the lowers. So I have now 6 uppers and lowers, buccal and lingual. Okay? So now I'll move to the posteriors, and I will first do the buccal of the uppers. So according to the curve that I determined on the 6 anteriors, I will follow by looking at the pictures and looking at that drawing that we did. This drawing, where's the drawing? Good that I didn't. Where's the drawing? Oh, we didn't do. I just showed. I showed the drawing. Okay. So according to this drawing over here, where is it? Here or here or here? This. So according to this drawing, I will wax up the bicuspids. Okay, so I will see the relation between the line, and I will guide my bicuspids and molars. Just the buccal. Meaning now I'm determining the smile line, the whole smile line and the buccal corridor. So the picture of smile will show me how much I need to fill in. So I'm always going back, each step going back to the photos. So the technician should do that. So the face photo will show me I need to fill in, add more wax on one side, less on the other. Smile line and buccal corridor are finished with the 4th step. Then 5th step, lower buccal occlusal of the lowers. Now that I have the uppers, I can slightly open the articulator and I can see exactly how I need to do the curve on the lowers to determine SPI and Monson. So the uppers, the aesthetic again, always the face aesthetic guiding all the curves. So I look at this by opening, and I can see the lowers, and I can see if I need to trim them or if I need to add wax, and I wax up the buccal occlusal of the lowers. So SPI and Monson are determined. At this point, sometimes we have to readapt the incisal pin. Once you're adding wax on the lowers, sometimes we run out of room to develop nice morphology. So then sometimes I have to increase like 0.5 millimeter, open a little bit more the pin, give me some more room. And then what I need to do is recreate context on the anteriors. So then I have to make another decision. Am I going to add on the lingual of the uppers or incisal of the lowers? Go back to aesthetics. Look at the smile. Okay, it's showing too much lowers. I will add more on the lingual of the uppers. Then go back to the lowers, finish the occlusion of the occlusal of the lowers, and then the last step is the occlusal of the uppers. And when I finish the occlusal of the uppers, I'm determining the occlusal context in centric relation or in maximum intercuspidation. So these are the steps, 6 steps of the full upper wax up. So you can see that in between every step I'm determining one specific thing, and I'm always going back to the photos, and each photo will give me a nice idea about what to do in each one of these steps. Okay, so going back to our case over here. Yep.
So when you're doing that, you're assuming that you're doing full mouth rehabilitation?
When do we want to record that?
Now. So now we're going to draw the smile line. Okay, that's the last step before bringing actually the intraoral picture. So how do I make this drawing? So I can either do the drawing first to guide me through this guessing process, or I can look at the video and try to see how much I can lengthen. Usually what we see is some dentists, they like to look at the patient speaking and they like to guess how much they think it should be longer. Or you can look at the pictures and look at the main pictures, as I mentioned, at rest, 12 o'clock, profile, etc. And at this point we have to bring in some very important information that I will share with you right now. So if I have this relation on the posteriors that I think is nice, I can just bring this line, and then following the lower lip I can continue and do the curve. Now, do you need a little bit of skills to draw this curve? Yes, you need a little bit of skills. But if you start training to be able to draw this curve, maybe you will also start shaping teeth better in the mouth. So don't be afraid of drawing. I know some dentists, they get really anxious when you ask them, make some drawings. The other way, some dentists, instead of making the curve, they prefer not to do the curve, and they prefer to look at the video and guess, I think we can lengthen 2 millimeters or 3 millimeters. So then we can bring the ruler, 1, 2, 3, and we can position the horizontal line as a guide. So now it's easier to draw the curve because you have the posteriors and you have this intersection. So it's really like connecting the dots. You know, if you have one dot, I'm gonna even make it more simple here. If you have, let's say, you like the molar, you like the position of the first bicuspid, maybe the cuspid needs to be a little longer, and you have this. Now I just need to add some in-between points here to improve my curve. One way or the other. We have to have all this information in mind. At rest, smiling, video, profile, picture at 12 o'clock, gender, character, age, lip dynamics. Mix everything and come up with one first guess. So let's draw. To draw, you have to click shape and click this last tool, the little pen. Once you click the pen, it activates the pen, and then click by click you can create your drawing. Don't worry about making a perfect drawing at the first time. To end the drawing, you have to double click. Wherever you double click, you're going to finish the drawing. Don't worry about a perfect drawing at the first time, because once you have this drawing, you can click twice on the line and reactivate the dots and change the dots by dragging the dots or moving on the arrows on the keyboard. My suggestion, move the dots on the arrows so you can go little by little and improve the drawing little by little. If you want to reactivate the drawing, let's say by any chance I stopped the drawing over here and I didn't get to touch the midline, and I want to one more dot. You double click here, you reactivate the dots, you double click on the last dot and the pencil is reactivated. You do whatever you want, continue the drawing. Want to finish, double click and the drawing is over. Okay, So you can make the first drawing, you can reactivate the dots, change the position of the dots, you can reactivate the last dot and continue to create dots, and then double click, you finish the drawing. Now don't worry, I'm gonna help anybody that needs help. So now that we draw the first one, so you can actually go back and measure. So in my case here, I'm lengthening 3.5 millimeters the central, and if I go back to his video, it makes sense. Okay, with the amount of erosion and abrasion and no exposure at rest, etc. 3.5 millimeters is not something impossible. So I'm fine. I'm happy with my first guess here. So if I'm happy with that, what I'm going to do is to click on this half curve and Command D to duplicate. Oops, I'm sorry. Click on the half curve and do a Command D to duplicate this half curve, and then I'm going to flip this curve horizontally. Once I flip it horizontally, I will drag it to the other side, and again the yellow lines will help me to position. So you will see these yellow lines. Okay. So that's the right symmetric position of the curve. So we can already notice the differences on the arch. We can already notice that you have different relation with the lower lip, and that probably making a perfect symmetric smile will not fit him because it's going to be too close to the lip on the left side, too far away from the lip, the lower lip on the right side, and also because it's probably impossible on his left side to build out the bicuspids that much. So I will adapt. So that's the first time we're going to adapt, actually the second time, because first we adapted the midline to a point that I believe it's reasonable. So this is actually what we will do when we are analyzing and adjusting a provisional. What do we do when we fit the full upper provisional in the patient's mouth? We ask them to stand up and smile at us. And what we're going to do is exactly what we're going to do here. We're going to look at the incisal edges when they smile, and we're going to see how we're going to shape it. Imagine if one side of the provisional is touching too much the lower lip, we're going to trim that until we create a nice curve. So that's exactly what we're going to do here. So you can change this line. The best way to change this line is to click on the line and to grab the corner, the upper out corner, the corner, this box, this square, not this one over here, but this one, because this one gives me all these movements. I can do whatever I want. And then I will position it to a more reasonable possible position. Somewhere here. If I want to change a little bit this one, I can also change. Now again, if I want to analyze if visually this makes sense, what I can do is duplicate the slide, click on the picture and delete the picture. I always like to do this. So now we are looking only at the lines. So I duplicate the slide, and then I click on the picture and I delete the picture. So when I do that, I can look at the lines, and the feeling I have is that the right molar it's stretching out here. You can see that this is kind of outside compared to that one. But this is kind of the limitation we're going to have on his case because his arch is not symmetric.
How did you get rid of a picture just to see the arch?
Just click on the picture and delete. Then I go back to the previous slide and I'm going to continue. So let's finish this curve and make it look nice. So now we can bring in the intraoral picture. So how do we do that? We're going to draw those transferring lines. So again, now that we know how to draw, we go back to our pencil, a little pen on the bottom there, and we're going to click on it, and we're going to draw a line that comes from the tip of the cuspid to the tip of the other cuspid. Now this cuspid you can draw, for example, this or this. Doesn't matter. You just have to remember what part of the cuspid you are so you can match on the other. So one click over here, double click on the other, and you finish the line. If you missed, if it's slightly wrong, you can click on the line, activate the dot, and move the dot to match the bicuspid. The cuspid, I'm sorry. And I'm gonna do the same thing on the centrals. Activate the pen. One click on the middle of the incisor edge of one central. One click on the middle of the double click on the middle of the incisor edge of the other, and we have the second line. Now the third line should be the tip of the papilla and the incisor embrasure, but it's already matching the how do you say, the hash line, hash marks. So it's already touching the other line, so you don't need to draw one line on top of the other. So you just leave these two lines. Once you did these two lines, you can click on the picture and delete the picture, so you only have the lines. I'm gonna save it and pause. So now I have to bring in the intraoral picture. So I open the folder with the pictures of the patient, and I will drag in the intraoral picture inside the slide, and it will come on top of everything else. I have to click on the picture and send it back. Click on the top there, back, so it's behind everything. And then after I do that, I have to calibrate. Okay, there's four things that we have to calibrate. We have to calibrate. It's like, imagine that we want to place this picture on top of the face picture, and we want to move it and resize it to make it match as best as possible, remembering that they will never perfectly match because of the difference on the angle of the pictures. So if you match the cuspids, you won't match the centrals. If you match the centrals, you won't match the cuspids. So what do we want? We want maximum precision in between the centrals. So the incisor embrasure between the centrals and the papilla tip on the centrals should be perfectly matching the face picture. And then as you move towards the distal, the distortion will grow. Okay? Then that's fine. So to match this picture with these lines, we have to calibrate four things. We have to calibrate the size of the picture, the canting of the picture, right and left position, up and down position. Okay? So remember, there's three lines: cuspids, incisor edge of the centrals, and the midline and the dental midline. On this case, we didn't draw the dental midline because it's matching the facial midline. Okay? Three lines. The first line, tip of the cuspids, will help me, will guide me through two calibrations: the sizing and the canting. Okay, so Forget all the other lines and let's place one cuspid tip on one tip of the line and one cuspid tip on the other tip of the line. The same way I did with this picture. So I have to remember what part of the cuspid here I'm touching and what part of the cuspid here I'm touching. So it's the inner part of the cuspid and the inner part of this cuspid. So I want to do the same over here. It's not here, it's here, and it's here and not here. But I could have done here, doesn't matter, but you have to do the same on both pictures. So the thing is, we're gonna change the size and the canting. The size I will change with my fingers or by grabbing the little squares on the side of the picture. And the canting I will change by clicking here on these arrows up and down. So I usually put one cuspid here and then I see what's going on with the other. So here one. Oops, this one is already too small. Now it's touching this one, but it's away here, so it's a little bigger. Touching here, not touching there. Again, touching here. The size is pretty much okay, so now it's just a matter of twisting, moving down, twisting, moving down. So this is pretty much it. Now once you calibrate the cuspids, delete the accessory line from the cuspid so it doesn't bother you to adjust the rest. What do you see? That when I adjust the cuspids, the midline is off and the incisal edge of the central is off. That means there's a difference of the angles of the pictures. That's normal. Remember, which was the other case I did in the morning was almost perfect. By chance, the pictures were very similar. This one, it's a little bit more off. There's a more difference on the angles. That's fine. But I'm going to delete the line over the cuspids, and then I'm going to move. I'm going to click on the picture, and with the arrows on the keyboard, I will move up and down, right and left, until I match the midline and the incisal edge. And then I can also delete this little line, and then I have the midline, I have the intraoral picture calibrated in relation with the cross. The only thing that is missing now to calibrate is the curve. We can see the differences here on the curve. If we look at the curve on this photo, it's touching the bicuspids. Here it's not touching. Here it has some space over here, and here it has less space. So afterwards I will calibrate the curve. How do I calibrate the curve? Clicking on the end here and dragging it to the point that I want. Same thing over here. Don't need to be perfect, just similar. So that's my curve. I save and I duplicate, or I duplicate and I save. And the next step after we duplicate the slide I already did is to work with proportion. So to work with proportion we have to add the rectangle. So you click on shapes, and the fourth one is the square. So you add the square in the slide. Now we want a square without filling and with a very visible colored line. To do that we have to go to Inspector and click on Graphic, the green little icon here. First I'm gonna go to Image Fill and select None. Second, I'm going to go to stroke and select line. Once I select line, I want to click on this little square here, make sure it becomes dark. When it comes dark, I can pick the color. A nice visible color, light blue for example. And then this is the thickness of the line. I want to make it a little thicker, so 3 pixels of thickness should be fine. And I can close the window of the colors. So now I have my square. Now to measure the proportion, I have to bring this square and to make the square to touch all the sides of my central that I want to measure. So let's measure first the right central. So touching the zenith here, gingival margin, touching the distal, touching the incisal edge, touch here better, here, and touching the midline, the mesial. Okay. Once I do that, I can click. Let's wait until everybody gets here. Yeah, but with the proportion we don't need the ruler for the proportion. You have to click select the square or the rectangle, and you go to this icon, the matrix, the little ruler over here. You click over there, and you have the size of this rectangle. Okay? So now I want to constrain the proportion. I will click here on this little window to constrain the proportion, to lock width length proportion of this rectangle. Once I do that, I can change the height and it will automatically change the width because you locked the proportion. So if I write 100 on the height, once I press enter, it will change the width. Now it gave me 131. What does that mean? It means that the proportion of the central is 131%. That means it's 30% wider than longer. So it's the opposite than the ideal central. Okay? So let's make a note here. 131%. How do you write inside the shape? You just have to click on the shape and how do you call it? And type.
Click on the shape and then
Type.
check and then type.
One step that I forgot to make it easier, before duplicate the rectangle before actually finding out the proportion and writing, so you keep the original one to make the next step over there. So 131% is the actual proportion. The next step will be measure or compare with the ideal proportion. So what I need to do is to click on the rectangle and change it this proportion to the ideal 80% proportion. How do I do that? I have to unblock the proportion since I need to change the proportion, and I need to create a new proportion. So I will write 100 on the height and 80 on the width and click enter. When I click enter, I have this new little ideal rectangle. Once it's ideal, I can re-block the proportion and lock the proportion. So if I have a square and I need to change the proportion, I will unlock, change, create the new proportion, and then lock again. Once I have this rectangle and it's locked, what does that mean? That I can change the size without changing the proportion. Okay? So I'm going to bring this rectangle so it touches the axis of the cross here, the intersection. Once it's touching here, I can then grab this corner and change the size of the rectangle. And then usually I stop when it touches either the cervical or the width, and I make the first analysis. The first analysis here is that if I keep this midline where it is, if I keep the incisor edge like this, if I don't want to change the cervical, that's the relation between the ideal proportion and where the tooth are, this distal is. If I keep making it big until it touches the distal of the tooth, because we cannot change that relation, now I have the relation between, if I want to increase the length this much, this is what I need to change on the cervical to create the ideal proportion. So that's the first analysis. Now when I look at this, the first thing I want to see is go back to the video and look video and photos and see when he smiles or speaks, does he shows this area. And I can tell you he doesn't show the cervical of the centrals. So maybe it doesn't make much sense to change the cervical margin of the central. So since this is one reality, I can write down on the slide, since you don't show the cervical, maybe we don't need to worry about the gingival margin. Now the second thing that I want to do now, it's always the game of the actual. So that's why I like to put here the red. Then I bring the ideal in green. You don't need to do that if you don't want. This is 80. And then the final analysis is the, what did I wrote on the other one? The acceptable. So now I already know the actual proportion, I know the relation with the ideal, and I want to adapt to his reality and see what kind of proportion we will end up. So this is, let's adapt. So I want to unblock the proportion so I can change this rectangle, and the main change is, let's not move his cervical. This is one option. What is the other option? Let's move everything down and make it even longer. So if this was a guy with a high lip line and showing the whole central, we could probably think about crown lengthening or making it longer. Testing in the mouth, in the mock-up, if he could handle a longer central. Now it's probably almost 4 millimeters of lengthening. Okay? That's not a bad idea also, because he lost a lot, and we're going to open the vertical, we're going to move the lower, so we have a lot of freedom here. So now if if we don't want to move the gingival margin, the other thing that the other analysis that I can do is, what is my limit? And I mentioned about 70%. If you give a 70% proportion to the technician, he can play with the line angles and still create a nice central. So from 70 to 90%. Actually, I want to go higher, 90%, I'm sure. Sorry. So how do I analyze 90%? If I want to check what happens with the 90%, I have to write 100 over here, 90% over here, and press enter. Once I do this, I constrain the proportion, I place it over here, and I stretch. This is pretty much what will happen. So if we don't change the width, if we don't change the cervical margin, and we lengthen around 33.5 millimeters, we can still create a decent central. So this gives me a nice reference that if I lengthen 3.5 or more, I'm in good shape. I'm having a decent shape. So that's why I want to test. That's what I want to test with my mock-up. So this is the acceptable. %. So that's the way I'm gonna.
What numbers did you put in?
Huh?
What numbers did you put in those two boxes? This one? Not no up on the metrics.
Here, this one I put 190, and the ideal 180, and then the other one I did the opposite. I measured the tooth, and then once you put on 100, it's going to show you the proportion. Okay. So this is a very simple procedure. Let's say you have a case, a simple case, with direct composite on the anteriors, okay, and you do a quick mock-up on the patient and you add 2 millimeters of length on the centrals and it looks good. When you have the picture here, if you, let me duplicate this so I don't mess up with our presentation here. Let's say, forget about the curves, forget about everything. You come to the patient, you do a mock-up, you add 2 millimeters and it looks good. So you come here, and you take the picture, and on the computer you measure 2 millimeters. And then you just bring the rectangle and you can measure if by increasing 2 millimeters are you in the ideal proportion. So you can do very simple measurements and get simple conclusions about how much you need to do. So now everybody can get to this stage with these 3 measurements. The important thing is to understand what you're doing. Okay? How can you measure these things? And why you're measuring them? Actual, ideal, and acceptable proportion. I will save it, and this is something that I like to do because it gives you some nice inputs here. Let's say I want to play with this proportion here, and there is this kind of gingivoplasty that needs to be done. It's always nice to probe the anteriors, the buccal, to see if you can easily do that or not. So if I have a case like this, that he has this bruxism, he probably had an abrasion, and the teeth extruded, bringing the bone and the tissue, bringing the tissue together, maybe not bringing the bone. So maybe you have some room of enamel. It looks like he has enamel underneath the tissue. So that becomes very easy for you to make a gingivoplasty without having to open it and flap or shaping the bone. So this is a good indication that you can actually play with the margins a little bit in a very simple way. So this is nice if the dentist gives the technician this freedom, saying that if you want, you can have 1 millimeter of enamel, subgingival enamel, that we can easily remove and we can improve the proportion without having to make any other complex procedure. So I'm going to pretend that that was my final decision. There's 1 millimeter over here, and I'm pretty sure that he can handle this plasty without harming the biological width. Okay? So this is nice to be able to have this information when you're planning the case. So I'm going to start from this point, my drawing. So I'm going to duplicate this and position it on the other side. So we can see that on the other center is even less. It's really a touch on the gum. This can actually be done even on the day you're prepping. You know, you come with the electrosurge, you reshape, and then you reposition the margins of the prep. So you know that you're going to do this 1 millimeter subgingival and 0.5 millimeter on the other, and you're going to be leveling both centrals. So you can do that on the day you prep, because as we mentioned, the margins, the preparations can be very delicate and can be even supragingival, and you don't see the cement line. So it's not like you have to hide it. So this is the first thing. Once I have the two centrals with the proportion, I can duplicate the slide and add the drawing. Now, the drawing of the tooth of the centrals, I usually copy and paste from a previous slide that has already the drawings. I believe I didn't give this yet to you guys. So we will have to practice the drawing. So we can click and activate my pencil, and my suggestion is for you to draw on top of the existing tooth as a reference. Maybe already making it a little longer, just to guide us through the process. And then you can stretch. So it's easier. And then you can fix little by little. Now, this is also just a detail. You see that when you draw, the drawing is, how can I say, it's sharp, each angle. It's like straight lines creating your drawing. So if you click on the drawing, and you go to Format, Shape, Smooth Path. It's going to smooth all the dots, and it becomes a nicer drawing. Now the other thing I'm going to do, I'm going to click on the drawing, and I'm going to go here on Inspector, Graphic, on the line, and I'm going to make it a little thicker so we can see better. 4 pixels. And that's my drawing. And then what I'm going to do is I'm going to click on the drawing, duplicate the drawing, and flip the drawing and fit on the other side. And that's it for the centrals. I will save it. Now a couple of So how can I fill in this with a virtual veneer? So what I need to do is I can grab this shape and I can throw actually on top of any picture that has a nice color. For example, this one. So I want to grab this texture over here. Okay? Let's see if there's a better one. No. Nothing better, nothing better, nothing better, nothing better, nothing better. Okay. So when I do this, I draw on top of a picture. I select the drawing and I select together the picture. That means you click on command, you hold command means you can select more than one thing. So on PC you use control. So if you hold control and you start clicking on things, you start selecting all of them. On Mac it's command. So I hold command and I click on the drawing and on the picture. So both are selected. You see there's a square here and the square there. And then I just mask. Very simple. Once I mask, I have this floating veneer. Floating veneer. So where is this case going? Where's our case?
So is that what presenters
Is this?
usually
Huh? What?
big presenters? That's what they do.
Yes.
Before and after the mask.
So what I can do now is I can bring it over here. Now, what else I can do here? I can do this. I can flip the same way, and I can do this. Now the nice thing is that you can do this, and you can show the amount.
Oh, nice.
Okay? Now you can do on the laterals, on the cuspids, etc. The other thing you can do is that you can bring this to this picture or to this picture. So if I bring this over here, for example, and then I bring it over here, that's it, finish.
Nice.
I can put some translucency here just to see what I'm doing here. Now, oops. Now, what do we do with the lips? What we can do with the lips is this. Very simple. Very, very simple. I can crop the lip the same way I crop the tooth. I can crop the lip. I can make a floating lip. And now the lip, it's on top of the veneers. So you can actually intrude or extrude. And you can have the whole 6 anteriors. Now you can bleach. You can make them very nice and pink or green. But anyway, this is just what this is maximum type of simulation that I can do, on Keynote, and that I want to do, because I can go on Photoshop or any other specific software and make amazing simulations and make them disappear completely, that you make a perfect smile and you don't see that it's a simulation. That's okay, you can do that. First, it takes a lot of time and you need specific software, and it can work against you because you may not achieve that kind of result. So I prefer a simulation that is kind of gives a nice illusion, but at the same time you can see that it's, that it's fake. That can just be enough for the patient to understand what can be made and improved, but at the same time you can do it fast. So you can do this kind of simulation. The other thing you can do is to bring, like here you see I did all the 10, but instead of adding texture of teeth, I just added a white semi-transparent. And I think this is pretty much enough for the patient to understand what can be done. Okay? So it sees that it's fake, but he can see the improvements.
From you cut that outline again and paste it onto another picture to capture that.
Huh?
Capture that part of the other photo to bring back.
The initial step where you took the pictures or the outline of the
The
tooth.
initial step where you took the outline of the drawn and transported it over to a sample.
This actually is it's a tool on Keynote that you can actually make a drawing on top of the tooth. You can draw on top of a picture and crop the picture with any shape you want.
Not using the one we just did.
You can use the one you just did. So what I usually do, I come to my bank or my library of shapes, I copy it and I drag and I paste on top of a picture that has a nice dentition, like here. So I paste the shape. Once I paste the shape, I make sure that it's nice when you get some light reflection. You see these light reflections over here? When you can get these light reflections, and then I select the picture and I mask. So now I have this little veneer. Okay? And that's the way you can do it. Instead of just filling it with white, you can make it nicer by filling it with tooth shape, tooth color. So just continuing here so we can finish the last step. Since I have the outline of the teeth, I will just delete the rectangles because I don't need to play with proportion anymore. I just have the shape now, and I can just draw the laterals. Make it a little longer already. Smooth the path. Make it a little thicker. Make it a little longer. I don't want to touch the line because I want some dominance on the central. Not much. I can duplicate and flip, and the yellow lines will guide me through the process to position to the other side. Now we can see already the limitation here and here. So I need to make it wider. Or when I see this discrepancy, what else I can do? I can do the opposite. Said, okay, it doesn't work, so this is a better reference. Smooth, thicker, duplicate, flip, and position. This is the position. Now it's a little too short. Make it longer. Come to the other one, match the length. Both the same size. Looks better. Here, what we do here, I can check the probing, see what are the consequences of playing with the soft tissue over there, and I can come back to the face photo. If the centrals were not important, because they don't show the lateral, for me it's important because he doesn't show soft tissue. He shows more soft tissue in one lateral than the other, and that really doesn't look good. So I can show this to him and say that here maybe it's nice to reshape and to match the other side. So, and then the last information here is the cuspid. So I will draw this one. Now, if he doesn't show the cervical of the centrals, you can imagine the cuspid. So this really doesn't make sense to bother here, but what I want to do is to bring this down and say, okay, if I increase the length, this is a nice proportion. Now if I flip to the other side, let's see what happens. And then we see that this is not going to work. We can see that the cuspid is completely off. Now this is something nice. Let's say that for any instance we decide on doing ortho over here, or we want to show the limitations, that the two cuspids will never look the same. So what we can do here is this. Look at the cuspids. Look at the midline. If I draw this line over here, this is the position and the axis of this cuspid. And this is the position and the axis of this cuspid. Let's make it red. Now if I bring this over here and I duplicate and I flip and I do this, exactly. So now if I delete this and I show this, so you can see exactly what's going on. Now if for any instance I'm doing ortho, I can see exactly what I need to do with this to get here. So the type of movement that I need to do. If I'm not doing ortho, I'm doing restorative, then I have to play with the compromised situation. So this is just impossible. The other thing of doing ortho here, if you, how do you say, verticalize? How do you say when you do that, when you make it more vertical?
Upright.
When you make this more upright, the cuspid, what happens with the soft tissue? When you bring this out like this, the tissue move up. So what happens is that you're probably going to get a better harmony between this one and this one. So these are the things that can start coming. Of course it doesn't show, so it doesn't make sense. But now if we are playing with restorative only. This is impossible. I need to bring this in. Maybe a little longer. This one I can grind a little bit more and make it narrower, so I'm trying to make them a little bit more equilibrated. And the thing I'm going to do here, definitely I will not prep all the way up over here. I will do a complete supragingival preparation and a little veneer that starts from here and has a nice proportion and looks better. And then you will have like a root shape over here. So instead, this I see a lot. The patient has uneven soft tissue, but you're not going to change because the patient doesn't show or the patient doesn't want to go through surgery. It's better to make the restorations with ideal proportion, and either you prep subgingivally and let the restorations have a nice proportion and have the root, the tooth exposed, giving like a root shape. Or if you have to prep all the way up, just shape, make sure the technician understands he's going to shape the beginning of the restoration, shaping like root, and then make a nice proportioned tooth. So visually is much better. The soft tissue can be uneven, but the teeth will look better if they have ideal proportion. That's why people that have natural teeth and uneven soft tissue, it looks better because the crowns are still with the same proportion. And the tissue is uneven, but the teeth still look good. Now, if you make uneven soft tissue and the restorations bright and all the way up, so you have those bright cervical all over, then it's going to look 10 times more ugly. So that's the kind of thing that the technician needs to understand to shape them and to try to make a nice balance between the crowns, even though the soft tissue is not even. So again, I can delete this and I can take a look, and it looks pretty good. So that should be my final design. The only detail here, look at the cuspid. If we look at the cuspid, look just the cuspid. Look what I have to prep. I don't have to prep the buccal at all, but I have to prep a lot the incisal lingual to allow me to create and to move this incisal edge buccally. So this is the information that we can get from this area over here. Then I can delete the curve and I can measure. I already have the cross on the model. If I don't have the cross on the model, I can bring this up over here and make the same measurements that we did before. 3 measurements. Before, what we did, we placed the line on top of the teeth and we measured the distance between between the line and the incisal edge. If we are intraorally, we do differently. We place above the teeth and we're going to measure from here to the cervical, here to the cervical, and here to the cervical. It's not the cervical of the drawing, it's the cervical of the actual position of the gingival margin. Then I'm going to measure the discrepancies, the cervical discrepancies and the incisal edge discrepancies. So let me do that quickly. So let's say here, all the numbers that the technician need. 0.5 over here, 6 over here, 4, approximately 4 over here, is it 4? Yeah, 4. Then I will supragingival 1 millimeter over here. Here it's okay. Here it's like half a millimeter. Subgingival. Here's around 1 millimeter. Subgingival. This is more. This is like 1.5. And this is around 2. Now the last inciso edge, 1.5. I don't care about the laterals. Something.
You don't measure that from the line,
Huh?
horizontal line.
What?
You don't measure your incisal edge from the horizontal line.
I measure it from here to the drawing. Approximately 4.5. A little less here. It's 3. No, more. 3.5. 3.5. And this is actually minus 1 here, approximately. Reduce, so you can actually put the, you can put this plus. Something like this. And you can leave the ruler here so the technician can play. So these are the measurements. Measurements to transfer the cross, the cervical discrepancy, and incisal edge discrepancy. With this in his hand, draw the cross. He can mark the model on the cervical, so I would mark here the supragingival mark, and I will mark the subgingival marks. Here the wax-up will cover the tissue, so we can either make a mock-up simulating crown lengthening, and we can transform this into a surgical guide for crown lengthening in acrylic. So when the dentist opens the flap, he fits in the surgical stent with the shape of the teeth, and he can measure 3 millimeters from the cervical of the acrylic to the new level and trim the bone to that new position. And then the additions here on the wax, what I do is with the caliper I will add wax, and with the caliper I will make sure I'm adding exactly the amount that I'm seeing here on the wax up, so I have the same kind of lengthening on the wax up that I do here. When I have to reduce, it's easier. I just mark the model and I grind down the stone at that level. Okay?
You make a reduction guide first, just for later use. A reduction guide for later use.
Yeah, so now, then you have to think about what kind of mock-up. If you want to do an initial mock-up, you cannot grind the stone. Otherwise it's not going to fit. So on a case like this, I can make a wax-up. I throwing wax on top and leaving this over there. So it's going to have a tooth sticking out from the lingo, but it's just for you to be able to fit and to have a buckle idea. Then you can make a reduction guide, so you can trim that down and then make the other mock-up, and then whenever you prep that, you can make the provisional following that same silicone index. But then it depends on the plan. Okay. So now let me stop here, and I'm going to actually